Hi, this is Kathy. Today I'm going to talk to you about my experience with bone density and supplements. So excuse me if I look down at my notes periodically, but I do get a little nervous when I do videos, so sometimes I have to refer to my notes. So I'm going to talk to you about osteoporosis and bone density because that's what I've been diagnosed with. Osteoporosis is a condition in where the bones become brittle and fragile from loss of tissue. It could be from hormonal changes or a deficiency of calcium or vitamin D. So the density of your bone is reduced and becomes very fragile, and your bones can break over time. Not right away, but over time. And it is very common for your bones to lose density as you age. So about 10 years ago or so, I was in the doctor's office getting a mammogram, and I saw a flyer stating that women over 55 should get a bone density test. So I asked my doctor, and he agreed, and we went forward with that. And when you get a bone density test, they scan your spine and your hips, or one of your hips, because that's where you typically lose the bone density, but you can also lose it in your wrist. My diagnosis at that time was osteopenia, which is the earliest stages of osteoporosis. So I've had maybe four bone density tests since then. There is medication. However, the medication doesn't cure osteoporosis. It just helps strengthen the bone. Other things that help are walking and doing weight-bearing exercises. So luckily I do walk, so I have that going for me. I have a reaction to certain medications, and I had a reaction to a medication now by the name of Fosamax, which is a common medication for osteoporosis. It can cause bone and joint pain, which I experienced. I had taken it just 2 times, and I had severe joint pain from the top of my leg to the bottom, from my femur to my tibia. It was very unbearable, so I quit taking it. And ironically, a side effect of this medication, that it can cause your bones to break. So my doctor suggested that I take calcium supplements, which I had been doing, but they didn't really help. And then he suggested I take Prolia. Prolia is a medication that is injectable, and you get the injection every 6 months. I didn't want to take the medication because of the side effects. I had a seizure from a combination of medications that I took when I hurt my back, so I'm just kind of weary of side effects of medications. So I started investigating the the supplements from Young Living that help with bone and joint health. I follow a pharmacist who studies the science behind the supplements, and so basically from what I found out from her, I started using SuperCalc Plus, AgilEase, and Sulfurzyme. So since I've been using these supplements, my bone density has improved, and my doctor was very surprised because this doesn't usually happen. Your bone density continues to decrease again as you age, so he has never seen it get better. So why do I take these supplements? Well, I know exactly what's in them because I've researched it, and when I buy a supplement from Costco or a health food store, I don't know what's in it. My doctor says, oh yeah, you're taking that supplement from Costco. That's fine. Doesn't tell me how it works. And I've had multiple recommendations on this for calcium at a health food store. One person says one thing, another says another, and I don't feel that they're that knowledgeable about it. And also, a lot of those supplements, over-the-counter supplements, they don't have good absorption. So your body doesn't absorb them well, and that's not the case with the Young Living supplements. So let me talk about SuperCalc Plus. It's a blend of bioavailable, that means absorbable, calcium, magnesium, and some trace minerals from a red algae harvested from Ireland. So SuperCalc Plus helps with the support and structure and integrity of the density of bones. It promotes healthy bones by supporting the body's ability to resorb bone tissue and deposit new bone tissue. It provides a great source of calcium, magnesium, vitamin K, and vitamin D. All those are great for bone density. Okay, and now AgilEase benefits. AgilEase has turmeric in it, and it's a capsule. I'm going to just show it to you. Okay, sorry about that. I forgot to grab the supplements. Okay, so That's what AgilEase looks like. So it gets that color from the turmeric. It's in a like a veggie capsule. And then this is what the Super Calc Plus looks like. And then this is the AgilEase. And this is the Super Calc Plus. Okay, so let me talk about the AgilEase. So the benefits of AgilEase. It supports and protects joint and cartilage health. It supports the body's response to acute inflammation. It supports healthy joint flexibility and mobility. It is formulated with some essential oils for joint support. And it helps improve your quality of life, because if your joints feel better, you're going to feel better. It has in it, besides the turmeric, frankincense resin powder. It has undenatured type 2 collagen, calcium, a form of calcium that which is a natural occurring boron, and the essential oils of wintergreen, copaiba, clove, and northern lights spruce. Okay, now I'm going to talk about Sulfurzyme. This is a big bottle, and this is a powder. You'll need like a half a teaspoon 2 times a day. I usually just take it once a day, or I might put in a little bit more. All right, so Sulfurzyme has wolfberries and MSM. So the wolfberries are in there to help your body assimilate and metabolize the sulfur. Now, this is not sulfa. Sulfa is what some people are allergic to. You might find that into an antibiotic or other medications. This is sulfur. So the MSM is important because it helps to protect your cells and your membranes, and it helps to support your immune system, your liver, and helps with your circulation. So obviously that's all important. And then it has a mineral in there that helps support normal digestion. So that's great. So in summary, I believe that SuperCalc Plus, the AgilEase, and the Sulfurzyme have had a beneficial impact on my bone and joint health, and obviously then my quality of life. I'd be happy to answer any questions you have about these supplements, and I can send you videos on these if you want to find out more scientific facts about them. Okay, thanks for listening.